Night is not only for sleeping. A 23-year-old patient presents with right lower abdominal pain that has been present for 2 days. Clinical examination reveals tenderness and moderate guarding in the right lower abdomen. The laboratory shows a low leukocytosis. The C-reactive protein is still pending. The erythrocytes in the urine are double positive. Here is the sonographic examination, an oblique cross-section in the right lower abdomen. Please orient yourself and take your time looking at the image. As always, it is not very simple, but it should be enough for a diagnosis. Here is the image after switching on the color Doppler. So that you can orient yourself a little, the iliac vessels filled with color, and the structures lying ventrally of them. Here is another oblique section perpendicular to it, with the attempt to work out the structures found. This area corresponds exactly to where the patient indicates the maximum point of the pain. What do you think? Are you able to form an opinion? I hope so. Otherwise, please take a look at our resolution or at Sono2learn. The sonographic examination in the right lower abdomen shows, down here, the iliac vessels and the iliac artery for orientation. Ventrally, we see a rigid structure lying in the right lower abdomen. It extends from lateral of the iliac vessels over the iliac vessels to the medial. It is surrounded by a pronounced echo-rich reticular reaction. If we take a closer look at these structures, we see that here is a normal loop of small intestine, a delicate anterior wall, a delicate posterior wall. Here is a clearly wall-thickened loop of intestine. The lumen, the clearly thickened anterior wall, the clearly thickened posterior wall. The submucosa, the muscularis propria, the lumen here, bordered on both sides by the mucosa. The mucosa, submucosa, muscularis propria. And here it extends somewhat pointed into the surrounding area. Here we have the surrounding echo-rich reticular reaction. If we now try to visualize the whole thing again, here is this wall-altered rigid loop, and here is the echo-rich reticular reaction. If we look at where this loop probably originates from, then we encounter the colon here, the cecum. The loop originates from here. Admittedly, the color-coded Doppler sonography doesn't give us much additional information. We see the vessels filled with color, but the expected hyperemia in this area is not visible. Now, this is not a must, although we have set the device to be flow sensitive. Let's look at the second level here. Again, the iliac vessels here are wall-thickened loop of bowel. Now in cross-section, the image of the coccard. Clear, isn't it? And we can follow this again over to this structure in the right lower abdomen, namely the cecum. And from here we then see this wall-thickened loop of intestine with the surrounding reticular reaction, which runs here in an arc. It runs in an arc from the cecum over the iliac vessels. It is rigid and shows no peristalsis whatsoever. The surrounding pronounced reticular reaction. And here again, for a comparison, the terminal ileum. Here the terminal ileum. Similar course, also a little wall thickening here due to the inflammation. And a structure that we do not see but which is almost certainly involved is the right ureter. The right ureter also crosses the iliac vessels in this area. And this inflammation, if it is involved, leads to these erythrocytes in the urine. That is the reason for it. Was your presumptive diagnosis confirmed? I hope you recognized it. This was an appendicitis. And when the young person was operated on, the pathology showed the confirming findings, an ulcerative, phlegmonous, partly necrotizing appendicitis. We also found a covered perforation of the wall. We hope you enjoyed this short excursion. Thank you for your attention.